Hello, my name is Muhammad Faris Hakimi bin Muhammad Fauzi. My metric number is 09DMB19F1049. Today, I want to present about diabetes case in Malaysia. Definition of diabetes. Diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body cell for use as energy. Next is registered patient with diabetes in Malaysia in 2019. Note, the data source National Diabetes Registry Report from 2013 until 2019. In 2019, a total of 1,614,363 patients have enrolled in the registry, including 897,421 active diabetes patients. This graph shows that the blue color is registered patients with diabetes in Malaysia in 2019. This is number of patients and state. We have Selangor, Johor, Perak, Sarawak, Kedah, Negeri Sembilan, Pahang, Pulau Pinang, Melaka, Kuala Lumpur, Kelantan, Terengganu, Sabah, Perlis, Putrajaya and Labuan. All we can see is Selangor is the highest registered patient with diabetes, which is 232,054 patients, follow with Johor 228,166 patient, and Perak 175,762 patient. And we can see Putrajaya and Labuan is the lower registered patient, which is Putrajaya is 8,202 and Labuan is 3,836 patient only. And total of the patient is 1,614,363 patient. Then I will go to ethnicity of diabetes patient in Malaysia. This is pie chart. The data source National Diabetes Registry Report from 2013 until 2019. In 2019, a total of 1,614,363 patients have enrolled in the registry, including 897,421 active diabetes patients. This is pie chart. Pie chart ethnicity of patient of diabetes patient in Malaysia in 2019. As we can see, almost half of the patient are of Malay ethnicity, where it was 59%, and then almost a quarter of the patient are of Chinese ethnicity, where it was 20%, and then slightly below than 13 of the patients are from Indian ethnicity, and there was 7% for others ethnicity and 1% for foreigner ethnicity. Common side effects of diabetes. First is food ulcer. Developing a diabetic foot ulcer is a common side effect among individuals with type 1 and type 2 diabetes. These non-healing wounds form on the bottom or side of a person's foot, oftentimes becoming inflamed and infected. If not immediately treated, there's a chance of more severe complication, including amputation. Next, number 2 is cardiovascular disease. The risk of cardiovascular disease is elevated in those with diabetes. The American Heart Association determines diabetes to be one of the 7 major control risk factors for cardiovascular disease. Next is vision impairment. According to the National Eye Institute (NEI), part of the federal government National Institute of Heart, there are 2 diabetic eye disorders. One can develop diabetic retinopathy and diabetic macular edema or DME. The former often causes vision impairment, while the latter develops from swelling around the retina, similar to foot ulcer too. Early detection is the key to avoiding sometimes permanent damage. And next is stroke. Diabetics are also at an increased risk of suffering from a stroke. There are several mechanisms behind the cause of this association. One is a process called endothelial dysfunction, which involves inflammation and damage to the body's arteries. In this case, the health and function of the arteries become compromised, leading to inflammation and stiffness and increasing the amount of atherosclerosis or plaques. And lastly is nerve damage. The NIDDK explained that untreated diabetes can also cause various nerve disorders. The most common type of nerve damage occurs in the feet and hands, leading to decreased sensation, numbness, and sometimes pain in these areas. Next, I will explain about diabetes prevention tip for control. First, we can do is lose extra weight. Losing weight reduces the risk of diabetes. People in one large study reduced their risk of developing diabetes by almost 60% after losing approximately 7% of their body weight with change in exercise and diet. Set a weight loss goal based on your current body weight. Talk to your doctor about reasonable short-term goals and expectations, such as losing 1 to 2 pounds a week. Next, we can do is be more physically active. There are many benefits to regular physical activity. Exercise can help you lose weight, lower your blood sugar, boost your sensitivity to insulin, which helps keep your blood sugar within a normal range. What we can do is aerobic exercise, resistance exercise, and limited inactivity. Then what we can do is eat healthy plant foods. Plants provide vitamins, minerals, and carbohydrates in your diet. Carbohydrates include sugar and starch, the energy sources for your body, and fiber. Dietary fiber, also known as bark, is the part of the plant foods your body can digest or absorb. And then you can eat a variety of healthy or fiber-rich foods, which include fruit such as tomato, peppers, and fruit from trees anyway. And then you can eat vegetable such as broccoli, cauliflower, and leafy greens. Then you can eat beans like chickpeas and lentils, and you also can eat whole grain such oat or whole grain rice. Then lastly we can do is eat healthy fats. Fatty foods are high in calories and should be eaten in moderation to help lose and manage weight. Your diet should include a variety of foods with unsaturated fats, sometimes called good fat. Unsaturated fats, both monounsaturated and polyunsaturated fats, promote healthy blood cholesterol levels and good heart and vascular health. Sources of good fats include olive oil, nuts and seeds such as almond, peanuts, and then fatty fish such as salmon, tuna, and sardines. Saturated fats, the bad fats are found in dairy product and meats. This should be a small part of your diet. You can limit saturated fat by eating low-fat dairy products and lean chicken and pork. And then the conclusion. Diabetes is a slow killer with no non-curable treatments. However, its complication can be reduced through proper awareness and timely treatment. 3 major complications are related to blindness, kidney damage, and heart attack. It is important to keep the blood glucose level of patient under strict control for avoiding the complications. One of the difficulties with tight control of glucose levels in the blood is that such attempts may lead the hypoglycemia that creates much severe complication than an increased level of blood glucose. Researchers now look for alternative methods for diabetes treatment. The goal of this paper is to give a general idea of the current status of diabetes research. The author believes that diabetes is one of the highly demanding research topics of the new century and wants to encourage new researchers to take up the challenge. Thank you.